Hello, and welcome to a special edition of Carrier Talk. For those who are joining for the first time, welcome. Carrier Talks are hosted by Karyopharm Therapeutics and are a platform to raise awareness around topics that are important to the broader Karyopharm community. My name is Stephen Rotman, and I'm the Chief People and Corporate Engagement Officer at Karyopharm, and I'm honored to be your moderator here today. Today, we're very excited to be welcoming Dr. Alex Karoglian from the Fenway Health Institute. Welcome, Dr. Karoglian.
Thank you so much for having me. Great to be here.
Thank you. Dr. Karoglian is the Director of Education and Training Programs at the Fenway Institute and Associate Professor of Psychiatry at Harvard Medical School. We asked Dr. Karoglian to join us today to discuss the very important issues facing the LGBTQIA+ community, which feels especially powerful as many millions of people celebrate Pride during the month of June. Dr. Karoglian, thank you so much for joining us. We're honored to have you here with us today and help provide clarity and insight into a topic that many might not fully understand or frankly might not have given much thought to. I just want to take a moment. Could you give us some insight into your extensive background in this area?
Thank you so much, Stephen, for having me, and delighted to be connecting with your staff and audience today. I'm, as you mentioned, a psychiatrist. I'm based at Fenway Health in Boston, which is a federally qualified health center, where I practice clinically with LGBTQIA+ patients and community. I direct the Division of Education and Training there, which includes the National LGBTQIA+ Health Education Center, funded for the past decade by the US Bureau of Primary Healthcare. And I'm an associate professor of psychiatry at Harvard Medical School, where I'm one of the co-directors of the Sexual and Gender Minority Health Equity Initiative, and direct two senior clerkships focused on care for patients with diverse sexual orientations, gender identities, and sex development. At Massachusetts General Hospital, I'm the founding director of our Psychiatry Gender Identity Program.
Great, thank you so much for that background. Given your broad background and some of the exposure you've had and some of the different roles you play across the community, I wonder if a good starting point for us and for the audience watching today would be to help us understand some of the just foundational concepts and terminology pertaining to the LGBTQIA+ community. Do you think it'd be a good place to start?
Yeah, that sounds excellent. Thanks, Stephen. First big point to make is that there are many concepts and terms that we encounter when we first start focusing on caring for the LGBTQI+ community that can be initially very overwhelming and confusing for many people. So let's go through this together slowly just to make sure we're all on the same page. I'll make the initial point as well that sexual orientation and gender identity are not the same thing. These are two different concepts, two different experiences. Everyone has both a sexual orientation and a gender identity. So everybody listening to this session has one of each. And the concepts and terms we use to describe sexual orientation and gender identity today are different than the ones we had 20 years ago, 10 years ago, 5 years ago, even a year or two ago. I'm hearing new terms, particularly from my younger sexual and gender minority patients in the last 4 to 6 months, say that I hadn't heard a year or two ago. So part of this is a very rapidly moving linguistic and cultural revolution, which is very exciting. The second point I'll make is that the concepts and terms a given person uses to self-identify will evolve throughout their life in many cases too. Someone may initially identify as straight, later identify as gay. Someone may initially identify as a man and later identify as a woman, for example. So in healthcare, we don't just ask these questions once, check a box, and breathe a sigh of relief that we never need to have that conversation again. We know it's a health-related, dynamically evolving demographic variable, and we recommend asking these questions of patients every year, if not every 6 months, because it can change over time. An initial important concept as well is that of sex assigned at birth. When babies are born in most countries and cultures around the world, they're typically assigned one of two sexes based on physical characteristics, female or male. In some cases, intersex, if they have characteristics of sex development that don't align with society's traditional expectations for female and male bodies. We now know that these babies grow up, become children, adolescents, and adults who may have a gender identity, a fundamental core inner sense of their gender that doesn't align with society's expectations based on the sex they were assigned when they were born. So what is gender identity? It's a person's inner sense of being a girl, woman, boy, man, something else beyond girl, boy, woman, man, or having no gender at all. And we appreciate that many people have gender identities that don't fit one of the two traditional binary options of either being a girl or being a boy, either being a woman or being a man. So we appreciate that many people have what we refer to now as a non binary gender identity. And this is part of the naturally existing gender diversity that's always existed among humans across history and civilizations. It's just now in modern Western society that we're starting to make some more room for this naturally occurring gender diversity among people. Gender expression is how a person presents or communicates their gender to other people, to the outside world. That can be through mannerisms, the way someone walks, their voice, their hairstyle, the way they dress. And gender expression is quite complex as well. It's not necessarily the case that someone assigned male sex at birth wants to or ought to express their gender in a traditionally masculine way, whatever that means. And it's not necessarily the case that someone assigned female sex at birth would want to or ought to express their gender in a traditionally feminine way, whatever that means. It's also contextual. Someone may have a more feminine gender expression at work and a more masculine gender expression at home. It's cultural. What's considered feminine or masculine in one society is not necessarily considered the same in another society. And the reality is, each of us has aspects of our gender expression that society might consider more traditionally feminine and others that society might consider more traditionally masculine. So that's gender identity and gender expression in a nutshell. I will say you can't assume what someone's gender identity is based on how they look or how they sound. People have to self identify, and we go based on what people tell us. A separate concept is that of sexual orientation. And this refers to how a person identifies their physical, emotional, and romantic attachments to other people. And this is something we think about in three components. The first component is desire. This is whether someone is attracted to other people and what are the genders of the people they're attracted to. When I was in medical school, I was trained to ask, are you attracted to women, men, or both? We've now moved beyond that. We ask, do you have attractions to other people, to make room for asexual and aromantic people? And then the person says yes, we would ask, who are you attracted to generally, or what are the genders of the people you're attracted to make room for the fact that there are more than two possible genders. So that's desire. The second component of sexual orientation is behavior. That's whom someone is engaging in sexual or intimate activity with and what type of activity. And important to note that risk of, for example, sexually transmitted infections is based on anatomy and behavior, not based on identity per se, right? So someone may be a man who has sex with men. That's how they and their partners identify. That doesn't tell us anything about their body parts or what they're doing with those body parts. The third component of sexual orientation is identity, and that refers to the range of labels and communities that exist in society that a person may or may not affiliate with regarding their sexual orientation. Some of the more common ones are gay, straight, bisexual, queer, pansexual. There are many more. We have a glossary of terms on our website at lgbtqihealtheducation.org. People can check out for free. And the Q in LGBTQIA plus is one that stands potentially for questioning, someone who's exploring their sexual orientation or gender identity and hasn't settled on a particular identity. Or it can stand for queer, which 100 years ago meant bizarre, strange, or odd in English. Mid 20th century, it became a slur, a derogatory term for particularly gay and lesbian people. And then a couple of decades ago, the community reclaimed the term and said, you call us queer to hurt us. So now we're going to call ourselves queer, and we're going to do it with pride so that you can't hurt us anymore when you call us queer. And lo and behold, there are queer studies departments in colleges across the country now. Important, again, here to note that not everyone's going to feel comfortable being called queer. For gay and lesbian people of a certain age, it may be the last thing someone called them on the playground as a kid before harassing them or beating them up. So it can be associated with some trauma and be triggering. We have to let people tell us how they identify and reflect that language back. That may have been a long answer, but I think in a nutshell, those are some important concepts and terminology for the folks listening.
Yeah, no, thank you. That was incredibly important. And I think it really leads to the next question where for once we have that information, can you explain a little bit, how does that, having that information, how does that then translate into what healthcare professionals need to understand when treating this community? And then how does that translate also into different health outcomes? And so as you ask about, asking the question every 6 months or the way people identify and self-identifying, not making assumptions, how is that critical in the care for healthcare professionals working with members of the LGBTQIA+ community?
Great question, and a really important one. To understand the health disparities and inequities in health outcomes experienced by LGBTQI+ people in clinical care and research and policy work, we increasingly rely on what's known as a minority stress framework. The idea here is that LGBTQI+ people from early childhood developmentally into adolescence and throughout adulthood experience everyday discrimination, victimization, microaggressions, frank violence, unfortunately, at a much higher prevalence than the general population. In recent years, the FBI has reported that one of the communities with the highest incidence of hate crimes in the US is African American transgender women. So this is, the unfortunate reality many people are living with. And a lot of that discrimination happens in healthcare as well. Many LGBTQI+ people at very high rates will report being denied care within healthcare systems, misgendered, referred to with the wrong name and pronouns, being actively harassed within healthcare systems, and having clinicians and care teams who don't know how to provide culturally responsive, tailored care. For example, gender-affirming hormone therapy or prevention and treatment of sexually transmitted infections among men who have sex with men as just a couple of examples. So we think of all of this as external stigma-related stress within the minority stress framework. And that can lead for many people to internal stigma-related stress over time, internalized homophobia, internalized transphobia, believing all the negative things that society has to say about your sexual orientation or gender identity, expecting rejection because you're so accustomed to it, and identity concealment to prevent mistreatment and abuse. All this stigma-related stress, we think, is related to what we see in the research and the literature, which is a much higher prevalence of various behavioral health problems among LGBTQI+ people, like higher prevalence of depressive disorders, anxiety disorders, post-traumatic stress disorder, in some cases substance use disorders as a way to cope with all this stress, decreased self-care, decreased engagement in healthcare due to some well-founded medical mistrust because people have had such bad experiences accessing healthcare. I can tell you, as an LGBTQI+ person myself, I still, get worried going to see my doctor just because, it's not how people are oriented and trained to provide care. And it's interesting being a clinician and also a member of the community, you really see this. And all of this down the road is associated with a higher prevalence of various physical health problems as well, including several cancers, which are disproportionately prevalent among LGBTQI+ people because people are afraid to go in for preventative screenings, for example. And for example, a number of cancers that are associated with the human papillomavirus, HPV, whether it's anal cancer, anal cancer or pharyngeal cancer that are HPV related, that are understudied, relatively underfunded by the NIH, and where there aren't great evidence-based guidelines for screening and prevention, and also lower rates of vaccination, HPV vaccination, to prevent these cancers in these populations. So it's very important to have health systems that are set up and where staff are trained to provide culturally responsive care. That means training all staff in basic concepts and terminology, like some of the ones I briefly reviewed a few minutes ago. Training all staff in sensitive and effective communication, for all staff to understand this basic connection between stigma and health disparities experienced by LGBTQI+ people, and then having a system for sexual orientation and gender identity data collection with patients, staff being trained to know how to document that in the electronic health record, how to look in the electronic health record to know what name the person goes by, what their pronouns are, for example, and also having policies, procedures, and forms that are inclusive, looking at the language on forms that patients fill out to make sure that that's inclusive. And in most healthcare systems, that still hasn't been done in a systematic way. Having non-discrimination policies that are protective based on sexual orientation, gender identity, and gender expression, for example, and then really engaging LGBTQI+ community in the decision-making within the organization, having patient advisory boards, patient satisfaction surveys. Do you have a workforce that reflects the full diversity of the communities that you seek to serve? These are all important things to create inclusive and affirming care environments for LGBTQI+ people.
Thank you for that information. There's a lot of those topics that I'd actually like to get back to in more detail, if that's okay.
Sure.
One that really struck me that you were talking about, I think quite often we talk about the LGBTQIA plus community as a community, and as you mentioned, there's a definite need to make sure that there's training and there's cultural norms to understand. But even within the community, can you talk a little bit about the need to understand the different identities within the community when we talk about the differences with race and ethnicity and heritage and ability and age, because within the LGBTQIA plus community, it's not a one size fits all, right? And I think some people do it a disservice by assuming that kind of that community is one, and in fact it isn't. And so, is there any kind of light you can shed for folks listening or watching for how to be more in tune with the needs of the community and how to best think about it?
Great question, and so important. The LGBTQI plus communities are not a monolith, right? And that's why we use this acronym LGBTQI plus, because there are so many diverse and important communities that this term refers to. And historically, it's been the case that people often group everybody together and assume all these subpopulations have the same experiences and the same needs and health needs. And that's not the case, as you say. The reality is each of these subpopulations has unique experiences, unique health needs. As clinicians, just because someone is, say, an expert in or has a lot of experience caring for men who have sex with men, that doesn't mean that they are skilled to provide tailored culturally responsive care for uh, sexual minority women, or cisgender sexual minority women, or for transgender and gender diverse populations. These are all very different communities with different lived experience and different health priorities, different primary and preventative care, different cancer risks, for example. And it's also the case that all LGBTQI plus people also have intersectional experiences where their experience of their own sexual orientation, gender identity, sex development is also influenced by their race, their ethnicity, their linguistic and religious background, their socioeconomic status, their age. And we need to really get to know our patients individually and understand in a more comprehensive, well-rounded way all these factors and not make assumptions about people, right? So if someone tells me that they're a lesbian woman, I may project my own experience on this based on lesbian women I've met in the past, but they may have a very different experience, the person in front of me, based on their again, race, ethnicity, where they grew up, what their family was like, where they went to school, what their employment prospects have been. So we have to really be careful to listen to people, hear who they are, and proactively be vigilant with ourselves to not make assumptions about people we're engaged with.
Great, thank you. Thank you so much for that. One thing I think we often hear about is the need for self-advocacy, right, in healthcare, and the need for patients and families to advocate for themselves and make sure that healthcare providers are listening. And I think that's especially true for the LGBTQIA plus community. And so when you're when you're in a health system like Fenway, my assumption is maybe there's less of that needs to be done, though you should always be advocating for yourself, but there's a lot of cultural awareness. When you don't have access to a health center with that level of training, how would you recommend that patients or families of patients within the community advocate for themselves and seek out the best possible treatment when maybe they don't live in an area or have access to care that some others do?
Great question. And we do a lot of what we call assertiveness training with our clients and our patients, right? For better or for worse, LGBTQI plus people have to advocate for themselves in healthcare and in life. So we talk a lot about assertiveness, engaging not in passive communication, not in aggressive communication, but effective assertive communication to get your health needs met. And this, to your point, which was so well stated, is often something families have to do for a child as well. For example, a family of a transgender child. And I know people who've sought care in for example, the rural South, and had to advocate very proactively and eventually ended up moving somewhere where they had more access to gender affirming pediatric care for their child. We do work in all 50 states, in DC and Puerto Rico, and increasingly around the world to implement these health programs and provide training and technical assistance in this regard. Um, Families really deserve resources to understand what standard of care is so that they can be aware when that's not what their child is receiving or what they themselves are receiving. This has important policy implications as well. I mean, there's an Equality Act that was passed by the House of Representatives, is now in the Senate, and this would provide protections across the board in many aspects of American life for LGBTQI plus people. To some extent, families certainly, we do a lot of work with them individually and with patients to know how to advocate for their health rights. Um, at a certain point, the burden should not be on the individual, right? It should be the case that society is protecting the rights of minorities that are very susceptible to discrimination and mistreatment. So I see it as a combination of um, providing the tools for patients and community members and families to be empowered to know how to advocate for rights. We have a wonderful civil rights office in the Attorney General's office in Massachusetts that um, has protected the rights of LGBTQI plus patients to get their health needs met, and we work very closely with and have for many years, with the Civil Rights Office in Massachusetts, for example. Um, so patients advocating for themselves, healthcare organizations taking it upon themselves to be um, capable and competent, serving all patients who come through their doors, including LGBTQI plus people. And then at a certain level, it's really for governments to make sure that laws are being enforced and that people are being treated equitably without discrimination.
Yeah, so thank you for that great answer and giving that insight to people who might be wondering kind of what they should do next if they're not getting the care that they need. And it also leads me to ask a related question around, I think, 20 years ago, could we have been having this conversation about government advocating or hospitals advocating for, LGBTQIA plus community, even the term LGBTQIA plus. So in one way, I think of all the progress that has been made, and I wonder if you could shed some light on the progress that you've seen made, in the past number of years, and maybe where you expect to see the progress over the next maybe 10 or 15 years. And so, I know for me, thinking back 10 or even 20 years, it is amazing progress, but of course, there's so much more to go. And so I wonder if you could comment that from a healthcare lens.
Yeah, that's a really nice frame, Stephen. I appreciate how you said that. And there are a few parts to it. I totally agree. I think on the one hand, there's been enormous progress in just a few short decades and years with LGBTQI plus people achieving greater and greater integration into the mainstream fabric of US society and achieving major milestones and advances. It's remarkable to me that we've only had marriage equality in the US for 6 years. And now it seems inconceivable that we wouldn't have it. But I remember being a grown up living in the US without marriage equality myself for several years. We have now transgender women as Assistant Secretary of Health and Human Services in the US. So the second highest ranking person in healthcare in the US government is a transgender woman. We have an openly gay Secretary of Transportation in the federal government. We just had the first today NFL active football player come out as gay.
Yep.
I saw this morning in the news. So these are things I would have never imagined growing up as an LGBTQI plus person myself. And here we are. And certainly in healthcare, we've seen major strides forward in terms of centers of excellence like Fenway Health, but also healthcare organizations across the board increasingly realizing that they need to develop capacity to provide culturally responsive care. So we're in a very exciting moment. I'm very grateful that we're all alive now, and we're, as opposed to 50 years ago when you feared for your life pretty much anywhere in the US and certainly didn't have access to any measure of affirming and inclusive care. And I think it's going to be a very exciting golden age moving forward the next 15, 20 years of this becoming standard across almost all US healthcare systems. And there are a few components to that. One is this LGBTQI plus care, sexual and gender minority healthcare is currently not part of the standard curriculum for medical students, for nursing students, for psychology trainees, for social work trainees. And people end up playing catch up afterwards through continuing education opportunities, right? So that's what our National LGBTQI plus Health Education Center at Fenway does. We work with people who are already clinicians or on care teams in the workforce who are seeing patients in front of them and aren't quite sure what to do, and so access our resources. We need to reform medical education, and that's happening. I'm one of the 3 co-directors at Harvard Medical School of our curriculum initiative, Sexual and Gender Minority Health Equity Initiative, to do this as part of the standard curriculum for all medical students. Separately, healthcare systems are learning how to incorporate this, to have data systems that collect sexual orientation and gender identity, to onboard and train all staff to do this in a skilled way, incorporating best practices around gender affirming medical care or sexual health into their primary care practices within hospitals and health centers across the board. And also having policies that are going to be protective of their LGBTQI plus patients in terms of non-discrimination. I also see a big shift towards prioritizing diversifying the workforce within healthcare. And that way, it's very important for LGBTQI plus people when they go anywhere to access care to have the sense that this is a very diverse workforce, that people like them are providing care, are making decisions within the organization. So I think it's no longer acceptable, not just in terms of sexual orientation and gender identity, but in terms of race and ability and a number of other identities and experience people have. It's no longer really acceptable within any healthcare organization in the US to not have that diversity reflected at many levels within the organization. And that's really how you have decisions made through the lived experience of more than cisgender straight white men. And that's a great thing because that's what will really reflect the full diversity of the country.
Yeah, it's amazing as you walk through some of those advances that have been made, and agree with you completely that it's hard to imagine that marriage equality, for example, has been such a recent change here. And even personally, I remember explaining to people that for my husband and I, we were married in Massachusetts, but that wasn't necessarily the case across the whole country. And explaining that was a very bizarre conversation, and very thankful not to have to explain that anymore. But how recent that was, right? And so to your point, there's been rapid change in recent years, but also to your point, certainly lots of change to come in the future to get people access to what they need, and recognizing the needs of such a diverse community. So thank you for that. Wonder if we could pivot a little bit. So you just touched on what's needed within healthcare community and having kind of the workforce of the healthcare world representing the community. And so, I think about, Cario Farm, and we always strive to be a very welcoming, inclusive workplace, but I think of so many organizations who are of a similar mindset. And so as different organizations and companies think about how they can make sure that they have an environment that's inclusive and welcoming and respectful, what are some things that you want organizations to think about as we're making sure that the environment is one that's welcoming to all, that's respectful, that's empowering, and that's set up for success?
Great question. And it's an interesting one because we're starting now to work more and more with corporations that aren't even necessarily within, you all are, healthcare focused company, obviously, that we're starting to work even with companies that aren't necessarily healthcare focused per se, but are interested in the wellness of their LGBTQI plus staff. And there are a number of pieces to this. It really starts at the top. Leadership, the C-suite, the board can set a tone of um, equity for all and identify and support staff champions who are really passionate about this and want to drive the work forward and marshal resources toward staff champions to do this. Employee resource groups, LGBTQI plus employee resource groups can be very valuable and foster a sense of community within the organization. Thinking about the entire hiring process, right? So recruitment, are you making it clear in your recruitment materials that LGBTQI plus people are strongly encouraged to apply for jobs? When you're interviewing folks, are you getting a sense of whether the folks being interviewed are ones who will be able to work in an environment that is inclusive and affirming and will be respectful with regard to diversity of many types within the organization, right? And I think you can pick up on things like that with the right questions during an interview process in terms of then hiring and onboarding people. Or is everyone being trained in terms of what the expectations are for an inclusive and affirming work environment? Um, and then do you have refreshers, say annually, for staff to stay on top of this? Do you have benefits that treat LGBTQI plus employees equitably? For example, do the health benefits cover gender affirming medical care? Are there going to be accommodations made if someone is affirmed in their gender identity and say leaving for gender affirming surgery during while they're employed at the company? And do you have are you being intentional and proactive about having representation at all levels within the organization? Is there mentoring for LGBTQI plus staff by more senior LGBTQI plus people who work there, so that there is a sense of investing in people who come in who bring diversity and that's something that's really valued? Do you have clear protections against discrimination within the organization and training around that in the context of trainings that may be provided already about sexual harassment or other things that are priorities for the organization? And then is the organization meaningfully honoring events like Pride, which you are this month, of course, Transgender Day of Remembrance in November, Intersex Awareness Day in October? These are things that are very significant. Is the organization showing up in these ways and showing up in communities, sponsoring community events as well, and engaging community in decision making within the organization? These are some of the things that can be very powerful.
Great, that's really helpful, I think, for so many wondering what are the right things for organizations to do? What are the right steps to take and benefits to offer and programs to institute to make sure that as employers we're doing the right thing for the people who might need it most. And so thank you for that. That's really helpful. As you're saying that, I wonder, have you seen in your line of work and for colleagues you've spoken to, have you seen an improvement at all in patients who maybe are having experiences at work or experiences at work kind of getting better? Are people able to be more comfortable at work? And I know this is probably an anecdotal response versus a data-driven one, but many years ago, it was certainly very hard for people to come out at work, and it was hard for, oftentimes you had kind of a double life situation. And in the counseling that your colleagues are doing, are you seeing a change in that? And are you seeing going in the right direction?
I think there's definitely been improvement over the years in terms of how comfortable people are being out at work and the level of support and understanding that LGBTQI plus people have from their colleagues. It certainly has improved. It doesn't mean that there aren't a lot of incidents still and challenges that people face, and there's certainly still a lot of people who do not feel comfortable being out at work or in their communities otherwise. There are regional differences across the country. From our vantage point, we're doing work in all 50 states, so I would certainly say that it's a very different experience in some parts of the country than it is in, say, Boston, in terms of what seems to be the average comfort level in workplaces. I also, often am hesitant to say that because hesitant to say that there's been a lot of improvement, because that doesn't help the one person who's really having a hard time with it, right?
Agreed.
And that doesn't mean that we shouldn't be vigilant about situations where there are difficulties. And for those of us who maybe come from I'm speaking from my own experience, immigrant families who come from other countries or parts of the world where it may not be as far along yet. Uh, Internally, I may have a different struggle, right? Because part of my coming out is also not wanting to have a rupture from my family of origin that may not be accepting. And we sometimes think because, the laws are improving in the country, or the average sort of cultural stage people are at in terms of accepting LGBTQI plus people is what it is. But people have, live in this country coming from a variety of different backgrounds and may have had challenges early on being accepted as who they are. And that may make it harder, and it may be a longer journey to get to the point where you feel like you're in a place where you can be out. And I am always trying to be attentive to that, because I think it can be even more painful when it seems like everybody's moved along and it seems like it's not a big deal for the people on TV or the people you meet around you, and it is a big deal for you and painful for you. That can almost make it even lonelier. So I try to keep that in mind and not make too much of a blanket statement that everything's getting hunky dory for everyone.
Yeah, and I think that's an excellent point, and one for everyone to remember, that everyone has their own journey. And while I know we're on the verge of running out of time, I'd love to close with your thoughts on just that topic. So everyone does have their own journey, and it's been true since the beginning of time, and it will be true forever, right? No matter how much things change, everyone will have their own journey, and everyone will have their own story to tell. And so, what is your advice to both healthcare professionals and just everyone of how to give respect to everyone's individual journey and do it in the best possible way?
Great question. When in doubt, be kind, be understanding, be supportive. It's not a race, right? People are going to come out when they feel comfortable doing so, and we're all coming out throughout our entire life, right? It's a constant negotiation. When I meet a new person in a new setting, and I'm in a taxi and someone asks me if I have a girlfriend or a wife, I'm constantly doing a risk assessment and thinking about whether it's worth getting into it with the person I'm talking to. So that's true. I think that's true for most LGBTQI plus people. And don't make assumptions about people. Know that the person in front of you may be queer, maybe trans. You can't tell by looking at them, by how they sound, by what job they have, by what neighborhood they live in, by where they went to school. So be open. If someone comes out to you in the workplace or in your life, I think that falls into two categories. Sometimes when a person comes out to you, they may say something along the lines of, there's something I really want to tell you, and convey to you that it's a big deal to them to share that with you. And in that case, you can say something like, thank you so much for telling me. I really appreciate that. And I'm always here for you. If you're just chatting in the break room at work and someone mentions that they went to the movies with their husband over the weekend, and you realize that they're queer, maybe they don't want you to make a big deal. Maybe in that situation, they want it to be just like everybody else. And you want to kind of roll with it and convey to them that you're normalizing that as you are all relationships. So you want to kind of read the situation and be responsive to that. Try to be attuned to where the person is at. And if you make mistakes, which everybody does, including those of us who are LGBTQI+, will step in it, every once in a while. Just say, I'm so sorry, I didn't mean to be disrespectful, be genuine, and then correct yourself, and people will appreciate that and understand.
Yeah, absolutely. I think be kind, and ask questions when you have them, right, in a respectful way. So thank you so much for that. I think that's advice that we can all take, and that hopefully everyone who listens to this or watches this could take with them. And Dr. Berlin, I can't thank you enough for spending this time with us today. This has been such an insightful time spent, so many topics covered, such a great look into the healthcare system and your insights into kind of the changes in our society. And then I know we probed you a little bit on the workplace as well. We just couldn't help it. So thank you so much for your time today. It's been absolutely wonderful. And we hope to talk to you again soon. This has been a really great Carrier Talk, transformative for me, for the team who put this together, and we're incredibly thankful. So thank you so much for your time today.
Thank you so much, Stephen. To you and your team, this has been such a treat, and we're eager at Fenway and the Fenway Institute to work with Karyopharm anytime. Thank you for doing this, and happy Pride to all.
Thank you. Happy Pride to you as well.